I don't know if American Bar Association, works something like this. If we use something from artificial intelligence today, then, what if it's any malpractice down on the road? Then who is going, ChatGPT is not going to go to the court and answer a question. But of course, it's on physicians. So I think advocate also for physicians at that level and bring more voices is very important. And that's why we so much rely on young trainees.
Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I am very excited because we have a repeat guest, Dr. Liudmila Schafer, and I guess she's going to be like the Gail to my Oprah or something because she's back and telling us more. So I want you to just give us a little recap about a little bit of information about yourself and what you do in medicine for the listeners who may have not heard your previous episode.
Well, thank you very much, Erkeda. You're so kind, and I'm absolutely fascinated the all progress, advances, and avenues. So thank you very much. It's my pleasure being here.
Thank you.
I learned for about being in medicine for the last, over 26 years, that it's a lot of physicians basically stay in a certain path. And I wasn't any different. So I was in academia. I was a principal investigator on clinical trials faculty, got even educational research grant, designed curriculum. So I was fully involved, just like many physicians in a very traditional path. And subsequently, I realized, unfortunately, after my dad passed away around August 2021, that I want to do something more outside one patient room. And like many of us, unless it's some situation happen or, significant, let's say, diagnosis or specific situation, we don't really deviate. So we let's say, see patients, or we do research, or we participate in one certain institution followed by law. And I just felt, there should be done more. So that kind of brought me to a revolutionary way. And I decided that, I should teach outside one patient room. At the same time, I was invited on Fox News to speak about colorectal cancer, pancreatic cancer. And when they started asking me about my personal story, and I'm advanced open water diver, and I do dance Argentine tango. I hike. I also read a lot. So I have a lot of different avenues and ride bicycle and so on. Just like many probably, medical trainees and your audience and overall people and, physicians, we have a lot of different activities. So it got a lot of traction and interest, and I started sharing story. And when I started sharing story, more and more people reached out, and the Doctor Connect was born. So then I went more into working as a contract as a medical oncologist and be entrepreneur. Next thing you know, the company grew, and we really focus on young physicians as well as kind of little mature, more physicians, for those who really feel that they are in one path. And you probably know, Erkeda, that it's very difficult to deviate. We still discuss today with physicians, and they feel like they work in one department, they do one thing, and they just, don't deviate. And let's say even criticize those outside. But when we get outside, one institution in the world, we learn so much. We share different experience. And we saw a significant transformation. Physicians start developing brand. So that's specifically what I specialize. I help young medical trainees early on and the physicians to develop that brand. because we have so many different interests. Starting from the medical school, we have to juggle so many things, go different, area, keep up with all kind of attendings, professors, classes. But we also like, let's say, jogging or listen to the music, or maybe have certain, hobbies and so on. So it's difficult to find a niche. And for physicians and young trainees, we combine the passion and expertise and develop that one brand. And we saw significant transformation go from zero to being on the reputable media, to develop brand, be on WebMD and Forbes and so on, as well as publish books. And related to our conversation right now, we are launching to discuss and actually publish book. It's called AI, Artificial Intelligence in Medicine. So we collaborate with the physicians, different specialties. And now either we practice with artificial intelligence or we don't practice at all.
I couldn't agree more. And I find like your story so fascinating because you've been doing so much over 2 decades of being in medicine, but still being true to yourself. I didn't know that you were such a wonderful dancer. I love hearing about that and hiking and all of those things, because I feel as though it's important for us to express and be ourselves and continue to find ourselves, because for those who just create their own identities only in practicing medicine, you can get that burnout and you can kind of lose that sense of self. So it's always important to do your hobbies. Speaking of your new endeavor with AI, there's been so much chatter about this and its influence on society. I'm sure a lot of people out there have heard about ChatGPT is very popular. I'd love to hear how you think AI can influence healthcare.
Right now, artificial intelligence really, I would say, at a very immature prenatal way. And it's only beginning of what we will see very soon. We discover that with not only ChatGPT is only probably a drop in the ocean, what we will be seeing for the next 5 to 10 years. And we don't even know the possibility of incorporation different platforms. However, we have to evaluate early on all pros and cons, because, people hearing, ChatGPT, and we have to understand that it might be different level. Number one is, let's say if we take different class, for example, young trainees or mid-level or higher, or for example, low-level employees, middle versus leadership. At a different aspect, different way we can apply AI. Let's say if someone just starting and want to create and write story, and they might just struggle with few ideas. You might, type something and you get a little idea. On the other hand, like I see in my situation, when patients bring in information, how to treat pancreatic cancer, colorectal cancer, or thrombocytopenia, and that really distract appointment. It's so much information. So what you are doing right now, educating early on, and we really want to raise this awareness for young physicians, young trainees. So we start express our voices as a physicians. So then we go and educate community versus then, let's say, overall community, people, population, or patients, they will be bringing to us and educate. So across different specialty, artificial intelligence will play a different role. And we could see something that it's very much moving forward, but also draw back.
I definitely think that there are so many possibilities out there, especially there was a recent study that said that ChatGPT performed at or near the passing threshold for the USMLE exams. And as it became more advanced, it kind of superseded some averages. So how do you think that will impact medical education?
So I think medical education already have been at a major crossroad for a while. I would say probably over a decade. And in the past, like I study, we used to study anatomy, pathophysiology, and different subject one by one. But then in medical schools, we start studying by systems. Probably medical students right now listening and they laughing at me. But now it's, for example, kidney, and we learn everything like pathophysiology, histology, anatomy, and so on and so on. So incorporation of this type of new tools into medical education, on one side, it probably will be helpful. So one, that it's much more data available right now than it used to be available 10, 20 years ago. So to memorize and keep up with everything is very difficult. Plus those like PowerPoint presentation when professors stand and give us 65 slides and expect for us to leave the room and remember, those days, Erkeda, are long gone. Mm-hmm. And now we incorporate in new tools up, and there probably will be new platforms, not just only traditional teaching from the, let's say, medical student to the faculty, or even peer-to-peer, let's say medical students, or between physicians, but also maybe medical student AI. And the change for USMLE exam on one side is good, but then we could actually lose some touch and human touch. So there will be a major probably, breakthrough, because we also have to understand that when physicians graduate, they cannot only rely on technology. They cannot rely just on data, because there's so much data and algorithm that we could make mistake. But if it's a certain task, yes. So passing USMLE exam, and not only USMLE and other exams, I think it creates right now also a lot of misunderstanding. It's exciting. It's a very exciting that we have platforms like this, but also the exam probably will need to be modified.
I couldn't agree more. And I love that it's, of course, showing that we need humans in medicine. Like, we need to adapt and adjust and evolve. And I like to think of technology as an adjunct to us to help us do better, to work at the top of our licenses, to utilize the other parts of our brain, and to spend more time with our patients and things like that. But we can't just assume that it's going to take over. We have to figure out ways in order to work alongside the technology. How do you think that early physicians could optimize their skill sets to kind of stay ahead of the curve?
Most of it be join different communities. So when we stay within, let's say, one university or one college or one hospital, if we meet the same group of people. And the same in my situation. So we meet the same, let's say, faculty, the same chair, attendance. And yes, we rotate, but it's one bubble. So probably expose and learn more about different ways of technology and join groups. Like, for example, in the past, we were only in one medical field, but now it's a lot of question. Why medical students did not learn anything? Why we did not learn anything about business or entrepreneurship? But then when we graduate, we expected to code appropriately, so then the hospital can bill based on our code. So one may be intertwined with a different specialty, and not only learn, let's say, maybe the business and the technology and new tools, but I would say that link and join different society. And maybe we don't need to lock ourselves in one society for, long period of time. Maybe I want to try certain society, not for a year, but only for 3 months, and give opportunity. Unfortunately, a lot of associations don't allow you have annual membership, and they lock you. And if I spend all this money, then I cannot join anywhere else. But I don't necessarily benefit, like, for example, in my situation from American Society of Clinical Oncology, when the membership, almost over $700, I don't actually benefit that much. So I think that intertwined with a different specialty could be one of the possibilities.
I love that you brought that up because I think that it's kind of a forbidden conversation in terms of the advocacy that is done on our behalf from our different societies. So we have so many. I'm sure a lot of the students may be affiliated with the American Medical Student Association, and they'll transition into the American Medical Association. There's the Student National Medical Association and the National Medical Association, so many. And then the ones for our specialties. And they charge a lot of money. And we're at a good point where there's so many things evolving in medicine. And like you said, there isn't a lot of business training and all of that, where we can actually work to advocate to tailor what we're getting from our medical institutions, from our societies for our needs to help us progress. So your generation may be the generation that helps implement these things and gets these things, because it's charging us a lot of money without giving us a lot of benefits. So we may have to create new societies.
Yeah, I absolutely agree. It's overcharged, and absolutely we don't even utilize that much. Mm-hmm. And in addition, just, pointed out, I was just thinking, but when we utilize different platforms, for example, for attorneys, I don't know if American Bar Association, works something like this. If we use something from artificial intelligence today, then, what if it's any malpractice down on the road? Then who is going, ChatGPT is not going to go to the court and answer a question. But of course, it's on physicians. So I think advocate also for physicians at that level and bring more voices is very important. And that's why we so much rely on young trainees.
Absolutely. Like I always say, like me personally working in health technology, AI is amazing. It will definitely help us transform the way that our system is working. It will give more access to patients. It will give more standardized care in terms of people following the guidelines so that everyone will get at least the very basic needs of care. But we need people to work that. And we need people to think outside the box. And we need people to also hold it accountable and double check it and all of those kinds of things, because these AI tools are not holding the malpractice insurance. So you can't just say ChatGPT told me to place that order. So you have to know your information, and you have to not just go into it blindly.
Yes. And in addition, that's why when we start doing collaboration on the book, Artificial Intelligence in Medicine, there's so many physicians reached out pretty much right away. And, someone told me, okay, but we are already writing an article in a big journal. We have to remember that submit article in the journal, it's a huge fee. I mean, we all know this. It's from $2,500 to $3,500. And then when that article in this journal, how many people actually read this article? Articles that I publish in the Journal of Gastrointestinal Oncology, if I want to access, I have to pay today $35 to $39. So it's a very small, skewed population that access those articles. So that's why we are putting right now collaborative book with the physicians of different specialties. And we already have OBGYN and psychiatry and plastic surgery and, oncology, hematology, rheumatology. Basically, we pretty much have every specialty. So we are putting collaborative book. And the book is not just will be skewed scientific data, but that would be probably outdated in 3-5 years anyway, but something in the form of story. So if we tell in the form of story and we explain historically how it's growing, hopefully it will make people think about it. And that book will be accessible to larger, wide audience, not only for medical trainees, for public, for community, and maybe people will read on airplane and waiting rooms. So I believe that this type of collaborative work and what you are doing right now, is way more moving us forward rather than just, put one article somewhere, which of course, if researchers listening to me, they probably roll in their eyes and it's okay. We've been there. So, but there are new avenues.
Absolutely. And this sounds so exciting. Like, I can't wait to read it. Hopefully, maybe it can be implemented into some of the medical student education guides. So can you tell us when should we expect the book out? And if the audience has any questions about all of these different topics that we've talked about, how they can reach out to you.
Oh, thank you very much. So we anticipate a launch book at the end of June 2023, and it's a collaborative. So will be Artificial Intelligence in Medicine, Physician's Perspective. And anyone who would like collaborate and as well as develop brand or also, do additional avenues and learn and grow as a physician outside one patient room, they can reach me at the website, thedoctorconnect.com, as well as I'm available on all social media network with me in any way through LinkedIn and Facebook and Instagram. And please reach out. We really would like to elevate everybody's voices at thedoctorconnect.com.
I love it. Definitely look for that book coming out in June. And we look forward to you coming on again in the future and teaching us more about what's out there in the world of oncology, as well as in the world of being a doctor who promotes evidence-based information in a logical manner from the physician's perspective. So it was so nice to have you on.
Thank you very much, Erkeda, for having me.
Thank you. And for all of the listeners out there, be sure to click that subscribe button. You can definitely reach out to me on my Instagram at Dr. DOCTOR, the letter D, Graham, and let me know if there are any guests that you would like to come on the show or any topics, or reach out to Med School Coach at MedSchoolCoach and let us know what else we could be doing. See you guys next week.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.